An emergency can strike at any time. It is usually unannounced and unexpected. As an emergency medical service, our role starts as soon as we receive the phone call for help, which is usually on our dedicated ambulance number 1066.
Hello ma'am, I need an ambulance please.
Okay ma'am. Where do you need the ambulance?
I need it in Kharghar.
Okay.
Once we have received the phone call from the roadside or from home from one of the relatives, an advanced cardiac life support ambulance is dispatched to the scene along with a trained paramedic. The paramedic would start the treatment as well as assessment right on the bedside or at home, depending on what his initial assessment is. Once he has done the assessment and the treatment has started, the patient is safely transported via the ambulance to the emergency department with ongoing care. During this phase, the paramedic would also inform the emergency department about the condition and the provisional diagnosis. How this helps is the hospital getting ready to receive that patient and all the various activities that would be required once the patient reaches the hospital. For example, if it's a suspected stroke, the emergency department, the MRI scanner, the neurologist, the interventional neurologist, and so on would all be prepared to activate the stroke pathway. If the patient was having chest pain and they suspected to having a heart attack, then accordingly the cath lab, the cardiologist and so on would be ready. There are actually quite a few times where no pre-alert is received and the patient just arrives to the emergency department. This is where a fully equipped emergency department with all the infrastructure, all the required medications, equipment are always present, along with a fully trained emergency medical team which involves doctors, nurses, housekeeping, paramedics, and so on. Once the patient arrives into the emergency department, the initial assessment by the emergency physician determines what time critical management needs to be initiated. Within a matter of minutes, various protocols are activated, such as the code STEMI for heart attack, code stroke for a stroke or a trauma team, depending on the condition of the patient. Once the management of stabilizing the patient is completed, the patient is then moved on to appropriate investigations, whether that's through a CT or an MRI scanner. Various blood tests are sent off and the patient is admitted or transferred to the operation theatre depending on their condition. Fully developed emergency medical system is what could make a difference between life and death.